and I am here to share some information and resources about speech therapy. So just to give a little bit of background about what it is, speech therapy works to build up social skills for those who need a little bit more help picking up on certain emotions or talking through their own. And it's especially useful to improve verbal communication and understanding nonverbal communication. And these therapists have a lot of education, including a master's in speech pathology. So for the most part, therapists that are working with children diagnosed with autism check in with each other a lot to make sure their communication styles and goals are aligned. And during my internship working with an ABA therapist, I actually got to overlap with a speech therapist and see a little bit of what they do firsthand. We were working with a 2-year-old little boy who had stopped trying to talk at one point, and his speech therapist was teaching him sign language during playtime to help him learn how to sign things in order to communicate. And his mom was telling me that ever since he started working with her, he was beginning to talk again. And it was really cool to see his progression from making small noises to humming and even trying to sing Baby Shark with us. So like that little boy we were working with, some kids with autism find social skills, including verbal and nonverbal communication, to be challenging and sometimes even really frustrating. So speech therapists help with things like pronunciation, eye contact, facial cues, and conversational skills. This can look like practicing speech, exercises to strengthen facial muscles, and playing games that can work on matching expressions to words. And it can take place in a clinical or home setting depending on the child and the family and what they're most comfortable with. So our lab is aiming for an earlier diagnosis for children with autism, which is so important because this allows children to receive earlier intervention. And the sooner a child starts to receive speech therapy, the more room that they have to improve. Usually therapists see the most growth in their toddlers that they work with. And most of the time with a diagnosis, speech therapy is covered by insurance. So for anyone who's interested in looking at resources in the area, I will leave some in the description. Thanks!